Hello everyone, my name is Victor and I have a real life story to share with you. It happened on one of the university campuses in Nigeria. There was a young lady who was having seizure disorders and was managed on medication. Was well controlled, no seizures, until a fateful day when she had a seizure on campus. The seizure came, was aborted, but her life never remained the same after that day. She lost her friends, and in fact, her roommate packed out of the room. Do you know why? It's because they thought that they risked developing seizure disorders by being close to her. Who told them? I don't know. However, I know that I have 5 misconceptions or myths about seizure disorders to share with you. I hope you learn a thing or two. Number one is that seizure disorders are contagious. Among some populations, it is thought that when saliva from an individual who's having a seizure comes in contact with another individual, the seizure is transmitted. Let's get it clear. When someone is having a seizure or fit, what is happening is that there's an abnormal electrical activity in the brain, and that is what is responsible for what you see as fit. And this is not transmitted from person to person. Medical fact. Myth number 2 is that when someone is having a seizure, they risk swallowing their tongue. Do you know what the tongue is? The tongue is a muscular structure in the mouth. It is made up of a number of muscles and it is firmly attached within the mouth. And it is not a medical fact that it is swallowed when someone is having a seizure. In fact, if there's anything to be bothered about, is rather that the tongue could block the airway and not that it is going to be swallowed in the process. Myth number 3 is that seizures could be beaten out or tortured out of an individual. And that is why in some population you see that when someone is having a seizure, they beat the individual or the light fires around the individual with the hope that the seizures will be beaten out. When you do that, just know that you are torturing the individual and you're not torturing the seizure. So if you know anyone who has a seizure disorder, encourage them to see a doctor who will be able to manage them appropriately. Myth number 4 is that when someone has a seizure disorder, they have mental retardation. Let's get it clear. There are some syndromes that have both mental retardation and seizures as a component. And it is also possible that someone who has a seizure disorder may also have mental ailments like depression and anxiety. However, it is not true that mental retardation is equal to seizure disorder. And seizure disorder is also not equal to mental retardation. Lastly, there's a myth that when someone is given anti-seizure medication, they will not be able to give birth to children. This is not a medical fact. Seizure medications have side effects. However, it is not a well-known fact that they cause infertility. In fact, there are people who have seizure disorders who are managed by doctors who are giving birth to children. When you have seizure disorder, see your doctor. They will be able to select which medication would be compatible with pregnancy for you. So in conclusion, those who have seizure disorders, they need our support. They don't need our stigmatization. They are not less humans and they are not less intelligent. Let's support them. Thank you.